Toothbrushing is a very simple technique, yet it can be very daunting for some people, but that's okay. Now, before I proceed further with this video, do me a favor, just pause this video right here, quickly go and grab your toothpaste and your toothbrush, and let's join in together for some fun activity. Hello, ladies and gentlemen, I'm Dr. Harleen Gill, and I'm going to be talking about effective toothbrushing in this video. Now, is that a new kind of a toothbrushing technique? It is not. It just simply means how effectively or how good are you at brushing your teeth. To the extent that, do you feel good after brushing your teeth? Your mouth feels quite nice and fresh after you've brushed your teeth, and when you visit your dentist, they tell you that your dental hygiene is awesome, it's great. As a result of that, now you're having very few or you're not having any dental issues. Or you're one of those people who is still struggling to figure out how to brush. That's okay. If you are one of those people, I'm here to help you out. So before we jump into the details of brushing their teeth, why don't we talk about what exactly are we aiming at when we are brushing our teeth? You just have to make sure that you are covering all the areas of the mouth, and you're also cleaning between the teeth and covering the nooks and the crannies where your brush would not normally go, but you have to make sure that it goes there, particularly right at the back of the last teeth. And the right way to do that is stand in front of the mirror so that you see what you're doing, and also be aware of where you are maneuvering your toothbrush and how. So when you are doing all that, I'm sure there will be a great improvement in the way you brush your teeth. And also, we're going to learn about the right way to brush. Now, I want to discuss a couple of other questions that patients normally like to ask the dentist as to which is the best toothbrush that you should use. Go in for a soft bristle toothbrush because it does less damage to the teeth as opposed to a hard bristled or a medium soft brush. They do a lot of damage to the gums and the teeth, and they lead to sensitivity, so avoid them completely. How many times should you brush? Ideally, we recommend you should brush every time you have something to eat, but I know that is not practically feasible, so preferably twice a day. Once in the morning after you've had your breakfast, and once at night before you go off to bed, after you've had your dinner and you've had your milk. Now in the morning, if you don't like the idea of not brushing before having your breakfast, that's fine. You can brush, have your breakfast, but you definitely have to brush after you have your breakfast also. And how often should you be replacing your toothbrush? Our textbooks recommend that you should replace your toothbrush after every 3 months. And after 3 months, your toothbrush will probably start looking like this, which means that you can see these bristles flaring out like this. So once that happens, which happens around 3 to 3.5 months later after using your brush, if this happens, you have to replace your brush because this kind of a brush will not clean teeth properly. That's the reason why you need to buy a new one. And for some people, there's no flaring out of the bristles like this even after 3 months. That's okay. But a word of caution here, if your brush becomes like this 2 to 3 weeks or even a month after you've bought your brush, it means you're applying or you're using this brush very, very hard like this. You're applying a lot of pressure, or you're scrubbing your teeth with a lot of pressure on your toothbrush. So you need to ease that pressure a little bit. You need to find that balance, that the pressure should be just enough to remove the food debris and the bacteria from between the teeth, from the surfaces of the teeth and the gums, and also from the nooks and the crannies around the mouth. So that you have to find that right balance there. The other most commonly asked question is that which is the best toothpaste that I should buy? All the toothpastes out there are really good because they have fluoride in them. And fluoride is a mineral that gets absorbed by the teeth, and it makes the teeth stronger and more resistant to dental decay. But there are toothpastes, which are the Ayurvedic toothpastes, that do not have fluoride in them. If you are using one of those non-fluoridated or Ayurvedic toothpaste, that's okay. You can keep using them, but I recommend that at night you can switch over to your fluoridated toothpaste. So you can use your Ayurvedic toothpaste during the day or in the morning, and you can use your fluoride toothpaste at night. That way you are going to have the benefits of both the toothpaste, and that's going to be a win-win situation for you. Great. Now I hope you've grabbed your toothbrush, because I have my toothbrush and my toothpaste with me. So grab your brush and make sure that your bristles are wet. Stand in front of the mirror. Apply a little bit of the toothpaste, just a pea size is enough, this way. Now I'm going to be demonstrating how to brush on these jaws. As most of us are right-handed, I recommend that we start from the upper or the top left side of your upper jaw first and go towards the right side. So when you are going to be starting from here, from the back side, don't overstretch your mouth too much. Otherwise the cheek muscles get so stretched up that they don't allow the toothbrush to go all the way right behind the last tooth. And that's exactly last tooth, that's here, that's exactly where we want the brush to go. And also tilt your toothbrush at an angle of 45 degrees towards the gum. So when you are working on the upper teeth, your brush should be tilting towards the gum upwards like this, and when you are working on your lower teeth, it should be facing downwards towards the gum. Now why do we need to give this 45-degree angle to the brush? Is because you can see the junction between the teeth and the gum, and this junction needs a really good clean. And when you give this tilt of 45 degrees, the toothbrush can clean more effectively, not only around this junction, because it is this junction where we find a lot of plaque, and also because the gum kind of overlaps the teeth slightly, and there's a little V-shaped gap between the gum and the teeth. So with the tilt, the bristles go into this gap and they clean up the debris and the bacteria from that area also. So what are we doing? We are doing effective toothbrushing, and this is what brushing is all about. Also, don't forget to brush between the teeth. Now you don't have to do something extraordinary or something differently to brush between the teeth. All you have to do is angle your toothbrush at 45 degrees like this and just jiggle it like this up and down, very, very gently up and down. Or you can also rotate your brush either in a clockwise or an anti-clockwise direction. It doesn't matter. Come across to the front, change the angle or change the direction of your brush. Go across to the right hand side, right at the back. Now when you started off from here, also make sure that you go right at the back of the last tooth. Come across to the other side, to the right hand side, and you are brushing behind the last tooth. Then change the angle of your toothbrush downwards, 45 degrees, jiggle up, jiggle down, or you can do the rotations. Come across this way and go across to the other side. Go right behind the last tooth. Now we are done with the outer surfaces of the teeth. We're going to do the inner surfaces. Again, 45 degrees facing upwards. So you can jiggle up, jiggle down, come across. When you come across here to the angle of the mouth, I want you to turn the direction or change the direction of your brush this way. So use your toothbrush in these sweeping movements. This way you will be doing better cleaning. The bristles of the brush will be cleaning more effectively between the teeth. When you come to the other side of the corner of the mouth, change the direction of your toothbrush again to the 45-degree angle and jiggle up, jiggle down, or you can do those rotations. Go right at the back, clean the last tooth. So we are done with the inner surfaces of the upper teeth. Now the lower teeth, again 45-degree angle, up and down jiggling. Come to the corner here, do the sweeping movements right across to the other side of the mouth, and then again change, go across the last tooth. This way you've covered all the inner surfaces of the teeth. Now we have to do these upper surfaces or the top surfaces of all the teeth. Again, starting from here, I'm doing this here, sweeping motion again, like this and like this. Be organized and systematic. Don't just jump around from right hand side and then go across to the left hand side, then come here to the front teeth and then go to the bottom teeth. Don't do this, because that way you don't do a good job. You also forget which were the areas that you covered and which are the areas that are left out. So the intention is not to leave out any area or any part of the tooth or even the gum. Okay, so this way we make sure that everything is covered, all the areas of the mouth are covered. And finally, don't forget to clean the palate. So the palate has to be cleaned this way, and similarly the tongue has to be cleaned this way. Make sure when you're cleaning your palate and tongue that you're not taking your brush too down or too you're not pushing it too backwards too much, so that you end up going right into your throat, and that way you can either gag or you will throw up. One of the most commonly done errors, or I'll say one most common mistake that most of the people do, I'll say 95% of the people do, is that after they've brushed their teeth, they have the toothpaste in their mouth, they spit the toothpaste and then they rinse their mouth. So do not rinse your mouth at all. When you rinse out the toothpaste, what happens, or what are you doing? You're also rinsing out the fluoride. You need the fluoride to stay in there so that the teeth can take that fluoride up and they can become more stronger and resistant to dental decay. So if you don't like the taste of the toothpaste, that's fine. You can just spit. You have to spit it out. Of course, once you've brushed your teeth, you have a lot of saliva and the toothpaste foam that is foamed up into your mouth. You need to just spit it out. You can do the spitting twice, 3 times, 4 times, 5 times. That doesn't matter. But don't rinse your mouth. I hope this tip helped you, and I hope you liked this video and enjoyed how to brush your teeth. And I'm wishing you best of luck, and I really hope that you can brush your teeth more effectively after watching this video. Thank you so much, and keep smiling. Bye-bye.